Welcome. I am Delaware State Representative Paul Baumbach, serving the 23rd House District. It is, Sunday, April 30th, 2023. Time for the weekend update that I've been offering regarding retiree health benefits. I want to thank you for joining. Also, just remember that this is saved off in Facebook, and I also save it off into YouTube so that you can catch it afterwards. Putting my email in the chain here. I have been doing this almost weekly for 2 months now, maybe even more than that. But I'm probably going to take a little bit of time off because the subcommittee is taking a little bit of time off. Our next meeting, our next meeting is in almost 3 weeks on Friday, May 19th, and I'm unable to attend that. And then the one after that is 2 weeks later on June 5th, and I plan to attend that one. I also want to note that the State Employee Benefit Committee will be meeting at 2 p.m. on Monday, May 15th, and their main agenda is to hear a report from the survey of state employees that was administered earlier this year. So consider putting that on your calendar. That's Monday, May 15th at 2 p.m. The State Employee Benefit Committee, SEBC, will have a meeting. Again, I think the main purpose of that meeting is that survey. So let's review what's happened recently. There was a meeting on Wednesday morning at 10 o'clock of the RHBAS, the Retiree Health Benefits Advisory Subcommittee, on which I serve as a co-vice chair. I was unable to attend the entire meeting as at 11 o'clock, I was presenting a bill before the House Health Committee. So I know some of what happened in the second hour, but actually I think some of the people on this call, tuning in, may be more aware than I am on how that transpired. So I guess I'll start with the agenda from it. I'm going to bring that up here. That's not the one I wanted to bring up. So let's bring that guy up. Okay, we'll get to that, the other one later. So this is, again, meeting from 10 to 12 this past Wednesday. We moved it around so that we really jumped into public. Actually, we talked about the status report, and there was a draft status report. Then we took public comment and then discussion by the subcommittee members, and then a vote on the status report. So the status report was posted online a little bit ahead of time, but not a whole lot ahead of time. And it was multiple pages long, actually 8 pages long. Did a lot of review of the past, and some of it's purely factual. Some of it, one can say, was presented in a positive light. Reviewed reviewed the legislation that set up the RHBAS. Reviewed some of the past actions of the past 2 months as far as all the meetings, reviewed a lot of the actions of the predecessor organization, which was the Retiree Benefit Study Committee, and also reviewed some of the material that has been shared within the RHBAS public meetings. And then, so it was really, I'll say, looking backward the past 2 months, I should say this report was a draft report that we were called to produce by tomorrow, May 1st. You can see task 5 for the subcommittee was issue findings and recommendations to the governor and General Assembly. Well, what was sort of changed things, you can see right here in this paragraph here, is 2 days earlier on April 24th, the State Employee Benefit Committee determined that, well, they reported why, but mainly what they did is they said, we're changing nothing through next June 30th. Before that meeting on the 24th, the SEBC had only agreed to maintain the Medic-Fill system, the current system, through December 31st of this year. So they add another 6 months. And importantly, that means since it's through June 30th of next year, from the General Assembly's perspective, no change to retiree health benefits would be made during the coming fiscal year, which goes from July 1st, this upcoming July 1st, through next June 30th. So the Medic-Fill will be maintained through the entire next fiscal year. And that's important because the whole reason we wanted to have a May 1st report to the General Assembly and the governor was in case there were budgetary implications of what we were recommending. So really we don't even have a choice in recommending Medicfill. We've got during the entire next fiscal year. So that's given us extra time as an advisory subcommittee to review what we should be doing going forward, because that point at which we're going forward has been pushed off an additional 6 months. Frankly, I think it's a positive thing. Give us time. I would like for that the Medicfill to be, I'm not speaking for the subcommittee, I personally, as a representative, as a member of the subcommittee, would like to see that the Medicfill maintained through the end of next calendar year, December 31st of next year. I believe there's some who view that as being a change that's cannot be made at this point, having to do with the outstanding legal difference of opinion, legal issues out there, and I'll get to questions after. I want to go through this first, and I'll get to all the questions. And by the way, I'll get to that later. Okay, so I'd rather it be Medicfill maintained through December 31st of next year, because retirees are fairly accustomed to the normal schedule of every fall. In October, you figure out what kind of retirement plan, Medicare supplement plan you want, or what your employer, or in this case, past employer, is offering. And if any choices you make, and you sign up, and you do that before the end of the year, so that as of January 1st, you have what your plan is for the next calendar year. If we stop Medicfill next June 30th, then that moves by 6 months what all retirees have to go through, all state retirees have to go through in choosing their next plan. It'll be simpler if, and hopefully when, it gets pushed through December 31st of next year, but we're not there yet right now, just through June 30th. So with that, this draft report notes that they're extending it. It notes some dollars that are estimated there, and there's difference of opinions on that. And then notes that we as the RBSC reviewed various choices to be made to address the funding shortfall. And this, let's look at this sheet. Lots of words. Ignore it. We're going to get there later. Okay, we'll come back to that sheet there. And various things have been discussed, but really hadn't been quantified for additional options that are available that would be designed to help address the funding shortfall, which is in the multi-billions of dollars. And again, a whole long list of things. We identified a bunch. We have on a list additional ones. Therefore, well, that's misstated. That should say the HBAS. So anyway, so we're looking to do bi-monthly meetings through August, and the next ones are, as I stated, May 19th and June 5th. And then our goal was to have a subsequent report no later than April 1st of this year. Now, it's actually 7 pages. 1 page is the cover page. That was a draft that was presented to the subcommittee. And again, this was after 11 o'clock, so I missed it. But my understanding is that the subcommittee decided not to release that, issue that tomorrow, because they felt that it was substantial enough that it required more time to consider, and I'll say importantly, maybe equally importantly, to have the opportunity to expand on it some, and that those additions were ones which the subcommittee felt could not have been adequately vetted in the public session on Wednesday. So therefore, what did they do? They charged the chair, Lieutenant Governor Bethany Hall Long, and the vice chair, Senator Brian Townsend, and myself, to work with staff to come up with a extremely brief and factually accurate, very, very high summary, just saying, we were created by this bill. We've had lots of meetings, considered a lot of things because of the actions of the SABC. We are delaying our report to you until October 1st. Just the facts, ma'am. No spin, nothing else. Nice and simple. And I would imagine as soon as that is in a good state, it will be posted on the public website there. So that's the first thing I want to say. Now let's go over, is there anything in here? So there was a presentation, again, this was after I left, about health reimbursement accounts. I'll get to this I'll get to my comment on why I'm currently not a gigantic fan of this. We'll get to the reasons in a bit. Of course, you need a big disclaimer. So it's a tax-free money is paid by the employer to an account for either employees or, in this case, retirees, who can then direct it to purchase healthcare costs or reimburse healthcare costs, including premiums for things like Medicare supplement plans, or for that matter, a Medicare Advantage plan, and along with any co-pays and all that sort of stuff. It talks about all the stuff is on the website. I'm just really breezing through it. What's eligible? Everything you would pay for healthcare that's not paid by your plan. So we set it up. Retiree has expenses, submit them for reimbursement. They're reimbursed as long as you have dollars in the account. Typically the plan sponsor, in this case would be the state, figures out who's eligible, provides access to a marketplace, a platform from which you can choose Medicare supplement plans if you're Medicare age or qualified. You can select, and it can be different types of plans, etc. And then generally you have somebody who's independently administering the HRA on behalf of the plan sponsor, in this case the state. There are variable costs, fixed costs like your premiums for prescription coverage, etc. And all this, and deductibles, co-pays, etc. And all this costs can differ, among other things, by age, by health, things like that. And this is a illustration of a typical retiree with a typical health reimbursement account. This is looking at one where, in this hypothetical case, the annual amount of the health reimbursement account contribution by the sponsor, let's say the state, would be about $5,000, and it goes up, let's say 2% a year. I think that's what's in this chart. And the idea is that the blue is your premiums for a Medicare supplement similar to Medicare, plus the prescription drug plan premiums. The orange is going to be your out-of-pocket, and the gray is what you're not spending in your HRA, and it accumulates. So what you see is that for the typical retiree, you're not spending a lot on health costs, and matter of fact, it's with the rise in the annual contribution to HRA, it's not until you turn 80 or so that you're now spending more than what the annual amount that goes into the HRA, which means it builds up in value. It builds up in value by several $1,000s. But then once you turn 80 in this hypothetical general view, then you start tapping it down, and then in time, you've got expenses that are just plain not covered. So once your HRA rolling balance runs out, in this case by 86, you're out of pocket for the excess. I'm not wild about this, but it's still, I think it's a good illustration of how health reimbursement accounts often work. And that's the last slide. So let me go to my preferred slide, and let's bring that guy up. Okay, so we actually saw this material. We saw this material in the previous RHBAS meeting. It's just we saw it on 3 different slides. I really like this slide. So let's talk about it. First thing is it's grouping 3 different approaches, which are options that the state can look at to reduce that underfunded liability of $8 or so billion. And the first group is funding options. So that is the General Assembly and the governor putting a dedicated amount of funding that goes up every year in amount, and starts at 1% and considered also 2% and 3% annually, frankly, until we fill the hole, until we address the full underfunding amount. And what we see is that putting 1%, which is $50 million a year and growing, if we put that we dedicate that, do it year 1, year 2, year 22, year 32, whatever, keep doing it. That in and of itself is projected to fill somewhere around 60% of the gap. That is a really non-trivial percentage, really non-trivial. And I'll go further to say, again, I speak for myself. I don't speak for the subcommittee. I don't speak for the SCBC, on which I don't serve. And I don't speak for the General Assembly. I'm one member of the subcommittee. I'm one member of the General Assembly. I do not serve in the SCBC. Speaking for myself, I think at a minimum, we're going to do this 1% step. So I think we've taken a $8.5 billion problem, and we're addressing about $5 billion of that, which is really substantial. So let's thank ourselves, or let's pat ourselves on the back, because I think that we're there. We've been doing, the governor and the SCBC and the legislature started this last June, and it's in the current proposed budget by the governor, supported by the Joint Finance Committee. So we've made some good progress there. Now, but let's look further. If we do 2%, we're going to get to 93%. I don't think we need to go 3%. Now, what's this mean as far as, well, what's just 3%, whatever. So the difference between 3% and 1% is roughly $100 million. And it's $100 million of services that we will not be providing to state residents. That's a lot of services that we would not be able to do if we did 3%. Each 1% is $50 million worth of services that are not money that's not being spent for other things, like maybe higher pay, maybe higher pension amount. It can be a lot of things you can do if you got extra $50 million a year. So that's where I think it's really helpful to see this column of the approximate funded ratio and say, okay, some serious belt tightening for 1%, some really serious at 2%, really, really, really tugging on that thing for 3%. You're giving up an awful lot of other things, good things the state can do if you're to put a full 3%. But we could do the full 3%, and we get there. We projected we get the entire gap taken care of. I think that's really important. My personal view is we should be somewhere around 1.5%. Let's say we get somewhere around maybe 75% done with that, with 1.5%, roughly $75 million a year, leaving 98.5% of what we would normally spend available for us to spend, and the other 1.5% is used to pay for what we have not prepared for over the past 40 years. So, okay, that's the first group, funded options. Let's come to the next group. So we've got some unique benefit elements to them. I'm trying to find the right nouns to use here. And for instance, there are employers out there that will have some kind of health benefit for retirees. And they say, we'll cover, when you retire, we'll cover your Medigap premium. And then, but only we're going to cover half of your spouse's. We don't do that, but if we did that, that would save the state some dollars, and that would help shrink that deficit we have in our funding amount. The next thing is what percent the state pays of your premium based on years of service. We could add an extra 5 years before you get to 50%, before you get 75%, before you get to 100%, something along those lines. And we don't do that currently, but we could do that. And that in and of itself could be could save some dollars. That's not the one I want. That's the one I want. Okay, so I'm using another slide here to find the details of what those all those details are. There we go. Okay, so currently, let's see, move it to, you need 20 years instead of 15 years to get 50%. Move it to 25 years instead of 20 to get 75%. Move to 30 years instead of 25 years to get to 100%. So that would be that graduated state share. Now, all of these things I should say this slide was presented to the House Democratic Caucus. So all House Democratic members we brought the consultants, the same consultants who come to the public meetings, came to our caucus and presented these slides. Again, this slide in and of itself, we've seen it in the RBA HAS, but it's presented all in one slide instead of 3 different slides. So that was just to bring members of the caucus up to speed with, frankly, where all of you already are. So that's the second one. The term vested, this is when somebody leaves employment from the state before retirement age, with fewer than a full retirement number of years, and presumably goes to another job, maybe another two jobs, and maybe changing careers, in their 30s or 40s or whatever. So right now, we provide health benefits depending on their years of services, and this would say no, you don't do that. But if you leave after 12 years and you're 42, then we're not paying your benefits at that point. You just don't have them. So this is something which we would grandfather in. I'll talk about that in just a minute. And then the last one is minimum required age to get benefits. So we don't have that now. I believe we require our state police officers to retire at a set age, maybe 55, maybe 50. Don't know. And other state employees in saying you do not get health benefits until age 60, or if you're a state police officer to age 55, if you've retired. So these are ones that we would, again, eligibility changes for future retirees. And I believe when I asked them this question, that this assumes that no changes are made for employees who have been with the state for a good number of years. I think it may be as little as 10 years. But it could also, depending on, we can discuss, this is a lever, this is a dial we can turn. Maybe 15 years, we grandfather no changes for somebody who's been with the state at least 15 years. But if you've only been with the state for 5 years, then you're going to have to wait until age 60 to get health care benefits instead of the current level. So that's each of those you can see is right around 20% in there. And I think that we can use, these are not necessarily additive. Actually not necessarily, they just plain aren't additive. If you were to do these four together, you're not getting 80%. You might be getting 30% or something. There's a lot of overlap, and you can't save the same dollar more than once. But I would personally, speaking for myself as a legislator, as a member of the HBAS, I would think that we'll be able to take 1 to, let's say, 3 of these and agree to recommend this in the final report to the SCBC, and that with 1 to 3, we should get, you couple that with, say, 75% from this 1.5% that I'd like to see. That plus this gets us to 100%. Let that sink in. You have 100%. You don't need to worry about the third category. What's the third category? Third category is you move to health reimbursement account. You move to Medicare Advantage. I'm not a fan of Medicare Advantage only. I'm okay with choices, but I'm not. And to get savings, frankly, I think you need to do a pretty thorough job of moving a whole bunch of people to Medicare Advantage. And I don't think that's what the subcommittee wants. I know that's not what I want. And then the HRA. So here's something I asked the consultants on Thursday. I said, so help me understand, I'm entranced by this Rhode Island system for an HRA benefits where the amount is not set per year, per employee, per retiree, but rather it's based on their age and what the premium is for this same, let's say, Medicare Supplement G. Whatever, let's say I'm 67, let's say the premium annually is $3,600. Then my contribution to my HRA from the state would be $3,600. Now I'm 86, and the premium for that same plan G may be $6,600. So give me $6,600 instead. So the amount is based on your age and goes up with whatever the current premium increases are for a plan such as Medicare Supplement G. So I said, so, have you modeled that? What kind of savings would you see? You want to see any savings? You may as well just keep Medicare. Like, whoa, wait a minute here. So what they're saying is you get that savings because it's this flat dollar amount, even as the retiree gets older and their costs exceed what your HRA balance is. And that's where these $3 signs come in. So let's talk about this column. I hate this column. And I am being really cynical here. It's been a long week, okay? Single dollar sign says, doesn't really make a big difference in the liability itself, the healthcare benefit liability itself. $3 sign says, you're really hurting people. It's frankly, I mean, let's not sugarcoat it. You're hurting people. You saw that chart. Let me see if I can get to that chart. Where do we want to go? We want to go to that one, and we want to go to that one there. Okay, so let's go back to this funny little chart here. Okay. Okay. So HRA is really great if you start off as a new, what do we have, 65-year-old. Okay. And frankly, you pass away by 85 or so. Okay, but what if you come in partway through and you haven't built up a balance in your account of 10 or 20,000, $10 or $15,000? It means you're going to run out faster. What if you're already 80? And that's where the crossover point is. So now the HRA is no longer paying your cost. You're out of pocket for this difference between the red line and the orange line every single year. HRA really is a problem if you're already older than 65. If you have this model where you're getting a flat dollar amount, goes up each year a little bit. HRA in a Rhode Island model doesn't save you any money. This model, the typical one, is really bad in your later years if you make it that long, and if you don't start at the beginning. So there's a lot to say that the HRA does not help in all situations, and there's some situations where it really doesn't help, which is another way of saying it hurts. So I look at this and say, again, speaking for myself, member of the General Assembly, member of the subcommittee, I don't like either of these. And frankly, if there's no savings to doing something like a Rhode Island HRA, then darn it, keep Medicare. What's the benefit of changing? It has to be a benefit to change. I don't see the benefit. I don't see the benefit without a big cost. Big cost, $3 signs. That means it hurts people. We put 3% of the budget, $150 million that we can't use on services for our state. It really hurts people. Let's try to avoid those $3 sign things. I think this is presented as $3 signs a good thing. I look at it and say $3 sign is a bad thing. I like to see big numbers over here, and I think we can do a combination. Personally, 1.5% plus 1 to 3 of these guys. I think that does the job that the subcommittee is asked to do. That's the job that the SEDC needs to do. I think that's a pretty good outcome. Okay, now I'm going to take that out, but I can bring it up again. What we're going to do is I'm going to go to questions. I want to point out that I'm now only posting this on my state representative Facebook page. I had some pushback of folks who felt like if I'm sharing stuff on my personal page of state stuff, then I need to have my personal page open for everything. And frankly, my personal page, And if people are being nasty over there, I'm going to shut them down. And because the life is too short, I've got my legislator life and I've got my personal life, and there's a line between them. And frankly, I need to not mix that line. So this is only on the representative page. That's a good thing for you. It means that you get to see everyone's question. So sometimes we've had people come in through one of the other 2 pages and put their questions there. You couldn't see. Now you can see everything. Okay. So we only have 4 questions or comments at this point. And let me see. You answered it. That may be Pat's. Okay, here we go. Very concerned at the town hall meetings, the governor still refuses Medicare Advantage to be, I'm going to say admit, I'm reading it, I'm hoping I'm getting it correctly, refuses to acknowledge that Medicare Advantage is horrible for seniors, and he continues to acknowledge that he's knowledgeable, and continues to not acknowledge, I think, that he's aware of any of the research out there. He continues to say he's going to push for it. Is all this a waste of time? Our RISE members are furious and growing tired of his lack of concern. You also said he put his 92-year-old mother on it. I'm sorry, he said that? Yeah, I certainly didn't. Okay, so Henry, I understand. I understand your frustration. We're moving heaven and earth to get these meetings. I've never been on a task force with so many meetings in such a short amount of time. We're paying consultants a whole lot of money to get this information to us. And therefore, I understand the frustration when in a town hall meeting, the governor seems to not be acknowledging the hard work of this Subcommittee and its observations. So I get it. But let's talk about the process. Our subcommittee is an advisory subcommittee. We will be issuing advice to the General Assembly, to the governor, and to the State Employee Benefit Committee. It's just advice. Whoever gets it can ignore it. So let's put it out there. Okay, we're advisory. Okay, it's a suggestion. I get that. We have 4 legislators on it, 1 from each of the caucuses. We both through the subcommittee and also through our emails, especially since August, legislators across the state, every party, every chamber, has heard from retirees and from current employees about their concerns with Medicare Advantage. It's not really clear that that's been internalized by the governor, but I'll tell you, it's been internalized by members of the General Assembly, at least those I speak with, and I speak with many of them. So, to the extent that the legislature needs to pass a law to ensure that we don't do bad stuff, I think we have the capability to do that. I don't think it's going to come to that. Obviously, any bills we pass can be vetoed by the governor. This month, we saw that even if the governor doesn't support things, we can still get laws passed. And then say these decisions are ultimately made by the State Employee Benefit Committee, the SEBC. SEBC includes a number of cabinet secretaries who report directly to the governor. But with Senate Bill 29, which we passed and the governor signed into law in January, we've expanded the SEBC, and it includes more members representing employees and retirees. It includes at least 1, maybe more than 1 retiree. So it has expanded, and therefore the voice of those cabinet secretaries is lessened. The share of their voice, the share of votes to reach a majority, has shrunk. And I believe if you look at the SEBC right now, you'll see that those who report directly to the governor make up a minority of that body. And I do not think that there will be any railroading going on in the SEBC. I think it's important that the RHBAS prepare a very thoughtful and smart recommendation by October 1st. And I believe that the SEBC will consider it very, very seriously. Frankly, if legislators feel that there is a high risk that the SEBC will completely disregard the work of this advisory subcommittee, then there's legislative action that we can consider. Keep in mind, we had legislative action that we had prepped in October of last year, and we didn't advance it because the lawsuit proceeded and had a outcome that postponed any change to Medicare Advantage. So I understand it's frustrating when we have the governor make statements in town halls that many retirees find very upsetting. But we have 3 co-equal branches of government, and we all have roles in there. And I think the SEBC is far different than it was 2 and 3 years ago. Actually, far different than it was 1 year ago. Far enough different. And I believe that this advisory subcommittee has its eyes very wide open, much more so than the Retiree Benefits Study Committee did, again, 1, 2, and 3 years ago. So I'm hopeful that we're going to, I hope that we're going to have a better outcome. And I think I see some light at the end of the tunnel. And I think we just need some time to have more discussion to really explore what if we take this from column A, this from column B, what really is the benefit of making changes to MedicFill? Aren't there other areas where we should be changing that we can fully address the funding shortfall? Okay, Mike. Last week you described retirees that are not 65 years old as having generous benefits. I think you mean compared to private sector benefits. Could you explain why you use the word generous? Sure. Mike, great question. And I'm going to bring up that guy there. And I'm going to bring that guy up. And there we go. Okay. So let's talk about this thing. The fact that I believe the answer is that I believe it's the case that right now, if you have 15 years of service, you'll get 50% of your premium paid for your Medicare supplement for MedicFill. 15 years of service for, I mean, your typical person works from 21 to, let's say, 66, just math works, 45 years. 15 years of service is 1/3 of a career. You work 1/3 of a career and you get 50% of your retiree health benefits covered by the state. Sorry, the Medicare gap. Okay, not your health benefits because you've paid into Medicare. I get that, but 15 years. That's a really low amount. And we're not talking about changing this for someone who's put in 15 years and is already qualified, but for new hires and for those with maybe 10 years or something, having that's what I mean by generous. Getting half of your benefits paid after 15 years of service. I'm a prime example. I have 10 years of service. I started when I was age 50. I had 20 years of work before that. For me to get 50% of my benefits in 5 years, I'm not complaining, but that's generous. I didn't take this job for the benefits. Absolutely not. And I know some people do, and that's completely valid. But that's unusual. It's unusually generous. Is it unreasonable? No. Is there some notable cost? Yes. If you look at the one about minimum retirement age for when you get your benefits, and I know it's extreme, but let's take a non-extreme. Let's say someone comes out of college with a teaching degree, because Mike, you're from the teaching, a great teacher. You get your job at age 21. You work 30 years. Thank you. You're 51. You've got 14 years before you're eligible for Medicare. We pay all that for 14 years? It costs $15,000 a year? It's over $200,000. We're not putting $200,000 per person aside. Are we cutting your salary by, what is it, $12,000 a year for that? No. It's a big hunk of money. And again, the state is not a company. But I don't know of any company that would pay your full healthcare costs at the age of 51 when you have 30 years of service in. It's just not how that part of the employment world works. I'm not saying that you're going to agree with me there, but that's what's behind when I say that those are generous. So I think that I want the subcommittee with public input to discuss these eligibility settings and say which ones do we think are ones we're comfortable paring back to help close the funding gap. Because I'll tell you, here's what's unfair, is not addressing this gap and having to sharply cut the benefits in the future, which we have to do if we don't address the funding gap. And I know I'm a numbers guy, and it feels like I don't care. I really care about people. I want to make sure that our retirees, and I want to make sure our new employees know that we will be standing by your pension. We will be standing by making sure that at retirement age, you are getting retirement healthcare benefits to supplement the Medicare that you've paid into. So, Mike, I'm not saying I've convinced you, but that's what's behind, which hopefully answers your question. Naveed, thank you very much. Debbie, thank you so much. Very helpful. Pat, generous benefits have to be weighed against non-generous salaries. Pat, I agree, but that's not a get out of jail free on everything. This is $8 billion. It's a lot of money. If you look at the difference between state salary and, frankly, let's look at schools. I think most private schools and parochial schools pay less than public schools. And I'm not saying that, there's so many more things. But we absolutely have a lot of categories of state employees who are paid less than they would in the private sector. But is it 5,000? Is it 10,000? What is the dollar amount? That's not a limitless rationale, justification for retirement benefit after retirement benefit after retirement benefit. I mean, scale matters, and we agree. I agree. I stipulate, I share, I agree that a typical state employee receives less pay than they would in the private sector. And therefore, and part of that, but it's not only for retirement benefits, it's also for job security. Because when we have downturns, we don't fire people, we just stop hiring them. We stop replacing them. And in the private sector, you get fired. So job security is also a notable benefit that state employees get that the private sector doesn't get, gets much less of. So there's multiple factors in there, and that's not because they're paid less, therefore everything is justifiable. We've got to look at the full picture, and we got to consider all of it. I'm not sure. I may have made a lot of enemies on that one. Okay. Pat, I did not intentionally miss something. Thank you for that, Pat. Okay. Got here. Oh, wow. Sorry. I did miss stuff, didn't I? Okay. Wow. Thank you. Okay. I got everything there. Jane, very good. Pat, I'm glad to hear that you'll be part of the trio crafting the short report to governor's election. This is not how it's set. Okay. And Pat, again, thank you. And even before I've read the rest of your question, I'm going to point out I was not at the second half of the meeting, and I don't know, but I thought I understood that the final report, which goes out tomorrow, because we couldn't get an emergency public meeting to have it vetted and approved by the entire subcommittee, that it was going to be done with the blessing of the leaders of the subcommittee. So I thought that was the case. I'm behind in my emails, so if it's in my current emails, I have missed it, but that's what I'll be doing as soon as we end the call, is getting to those things. So let me get to the rest of your question. I hope you'll append a statement since the committee. So I know almost for a fact that we will not append a statement that the sense of the committee is that MA will not be advised for current retirees, because that is a non-trivial statement. And I thought, my understanding, again, I missed the end of the meeting. My understanding is we are not putting in anything that is not provable. And we haven't had that vote. I wish we had. We haven't had that vote to include that statement. And we're not going to, I don't believe we're going to include any statement that we cannot back up 100%. We have gone through more than six painful months of things being in official stuff that's not entirely correct. We have not had a public vote on whether what the subcommittee feels about Medicare Advantage. We've had discussion, but not an official vote. It would, frankly, and I'm going to put this in stark language, for us to put that in would be the moral equivalent of saying Medicare Advantage is functionally the same as MedicFill. It's not accurate. The subcommittee has not come to that conclusion. Frankly, I was hoping that the subcommittee on Wednesday was going to go to that and was going to take the time to dig into it. It did not happen, to my knowledge. So I agree it would be a useful note, but the process, we have to stand by the process. There's no smoke-filled rooms here. The subcommittee has not made that determination. So unless that was in the meeting and when I was gone and no one shared it with me, if it wasn't voted on in the meeting, I don't believe it'll be in the report that goes out tomorrow. I think it's good. Keep in mind, no action's needed at this time. So that its lack of being in that draft report is fine. It's not an actionable report. It's your summer vacation report, okay? You don't have to do anything because of it. October 1 report, actionable. So would you like it better if it was in there? Would I like it better if it was in there? Yes, but it shouldn't be in there. If we had a full discussion of the full report and the subcommittee was comfortable with it, I was comfortable having something as detailed as was presented at the meeting. 8 pages worth of stuff is just too much to have approved. But if the subcommittee was of the opinion they wanted to get something of that scope and scale in, then I think they would have had a vote on that issue. And if it was majority in favor, they would have included it. That didn't happen. It would be wrong for me to push for its inclusion without a vote of the full subcommittee. And we would lose our credibility, and we know we know the repercussions of losing credibility. I don't think we can do that. I don't think we should do that. Okay, now back. And again, I'm sorry I missed your question before. Debbie, thanks so much. No problem. Pat, talk about we talk about that. Roger, thanks for serving. I've attended several meetings virtually. I'm hopeful the subcommittee will reach consensus. A group of options, provide a solution, provide feedback for retirees prior to submission of recommendations. Yeah, Roger, thank you for that very much. I would hope that we will have 2 different meetings. The first one will have a draft final report. We'll get public comment. It'll be sort of like this past week's one was. Okay, big, 8 or more pages, big report. And the draft report will not have what the elements of, say, 1.5% Paul's solution, 1.5% these 2 reduction of eligibility for pre-Medicare folks. Won't have that in there, okay? But it gives us the piece that we can build on at that meeting. We're going to hear from the public. We're going to discuss amongst the subcommittee. We may, at that point, say, okay, let's see if we have an agreement to add a statement that we don't want to have Medicare Advantage only. Even not want to have Medicare Advantage as a choice, whatever it happens to be, okay? Subcommittee discusses, subcommittee votes, majority vote goes in there. Okay, subcommittee less than a majority vote doesn't go in there. And maybe there'll be some follow-up work. We want to get one more piece done. And then probably we'll have a draft final report at the subsequent meeting 2 weeks later, okay? And so it will include what we discussed and voted upon at that first meeting. It'll be in the draft that comes out ahead of that second meeting. Public can still speak. We have a final vote on the final full report. Hopefully majority, it goes forward. That's the process that I see. Roger, I hope that makes sense. And I hope that's frankly within the range of what you would think would be reasonable. That's certainly what we're aiming for. Okay, Pat, again, sorry. Okay. Jonah Murray. During the town hall, there was mention of revenue from marijuana legalization. Where will that revenue go? Couldn't that be used for the funding gap? Thank you for raising that. First thing is that's years away. I think it's at least 3 years away before we have net money coming in from that. We've got to set up offices and pay for people ahead of time. So it's actually negative. It's costing money for the first few years. We also don't know the magnitude of it. It's a first time thing. So you don't know what the interplay of how much market we'll get from Delawareans who currently are going to New Jersey that will get their adult use legal marijuana in Delaware. Same thing with Maryland when it starts up. All the interplay of these things, we just plain don't know. And further, there's also equity features in there. So there's some of the revenues from that program will be going to good stuff. So it's already sort of earmarked and committed. Can that excess be used for OPEB? Absolutely. One thing that I think a member of the public raised before, I know a member of the public raised before, is we have had some good years financially. The past 2 years were good years financially, where we had notable more revenues for that upcoming fiscal year than the previous one, and then more so the subsequent one again. And when we have those years, we have more money, but what we don't do is spend it. We don't spend it for ongoing things because in some cases we had a jump that year from something that's not dependably ongoing, but rather it may have had one issue that was really good that may fall back. So there's analysis to figure out when the revenues come up, how much of that is likely from ongoing, how much of that may just be windfall kind of stuff. We did, and I'm really pleased with what we did. The Governor and General Assembly took a good piece of that and put it to one-time things. A lot of overdue maintenance of our school buildings, of our state buildings. towards water, cleaning up water without water throughout the state in ways that can get big matching from the feds, but only if we put money into it. So we put in $1, we get $2 back. It's not a bad thing to do, but it requires upfront money. So that's the water program is something that costs millions and millions. Well, in a year we have some extra millions. Let's put it in there so that when things are lean, we're not obligated to do it in that lean year. This is all intended so that as we add services, we only add services that we can maintain. Even when things get tight, we don't want to be pulling back on police officers. We don't be pulling back on people in our state service centers, helping those with health needs and such. So I say that in that we've had some good years recently. We will have some good years in the future. And I expect and hope that in those good years, we do take a piece of that and put it into the OPEB to get us to a great funding level. I'm not sure whether we should be aiming for 100% or whether 80, 85% is good enough to aim for. But regardless, while we're way low in that single digits, yeah, any good one-time years, we should be taking some extra dollars and putting into OPEB. I agree with you. Thank you for that. Okay, here we go. Time to explain. Lengthy question. I believe it was Secretary DeMatteis who said this week's SBC, they're going to continue their lawsuit to push for MA, and that's why she would not agree to extending the medical statement. Has our members upset? This is not over. Okay, so wait a minute here. So, as I understand it, and I am not a lawyer, and I'm also not someone who has pored over the lawsuit, the motions, the counter motions, the arguments, the counter arguments, the judge's orders. I've glanced at some of these things, but I'm no authority on this. If the state stops its objection, and I didn't mean to go here. As you can tell, I'm trying to figure out what the heck I'm going to say here. We have a problem. We have competing contracts right now. We have an emergency extension of the Medicville contract. The Medicville contract, I think, was a 3-year with 2 1-year extensions, or 2-year with 2 1-year extensions, whatever. And it had expired as of January 1st of this year. But the judge in October said, you will keep Medicville going. So because of that, the state qualified to do an emergency, break the contract, force a new contract, ignore the contract the state had signed with Highmark. Highmark is the Medicville administrator, but break the contract they had signed for Medicare Advantage because the judge had ordered that. So they could stop that legally, and they could force the state to quickly, as opposed to going through all the RFP and all that sort of stuff, force a expedited extension of Medicville, however long it was needed. And some of that depends on how long this legal dispute goes on. I'm not clear if the state were to, so for instance, if Rise were to, let's think here, if Rise were to give up, which it wouldn't, but let's go down this road and then we'll go to the other one. If Rise were to give up, then I think the judge's order would be automatically removed. And then you've got that whole issue of we need to resume that outstanding but paused contract with Medicare Advantage. It's accurate, factual to say the state has a legal completed contract with Highmark for Medicare Advantage. It's just paused by the judge, by the judicial system. And if Rise were to stop, I think that we'd have to stop Medicville at the point right now. We'd stop it as of December 31st of this year, until, with what SABC did on Monday, they negotiate a 6-month extension of that. Okay. Again, Rise isn't going to stop it. So that this is a hypothetical. It doesn't matter. Let's go for the one that matters. Okay. What would happen if the state were to say, Raj, you're completely correct. We take everything back. Again, also unlikely to happen, at least in that way. So if that happens, I'm not completely clear on what happens to the two contracts, the Medicare and Medicare Advantage one. Right now, one's active and one's dormant because of the judge's order. I don't know how you back out of that as the state. So, okay, let me see. Let me see if I think I'm rambling. So she did not agree to extend it. I think what she said is she couldn't extend it because the state law that says that the state has to follow its normal procurement process, which includes all the requests for proposal, the multi-month timeline for making, setting up contracts, signing contracts. The state was able to ignore those in order to extend Medicare past December 31st of last year because of the emergency, and emergency as defined in the Delaware law. And what the Secretary is saying, I believe, is that authorized them to qualify for that escape clause from the normal process in order to compel an extension of the Medicare contract. I think what she's saying is, while there's an outstanding lawsuit that could be settled in one direction or the other at some point, there's a limit of how far out they can go. For instance, the judge said you have to continue for the time being, and the state worked with Highmark to extend Medicare. They couldn't say, oh, let's extend for 5 years, because that's excessive given the situation. And what I think the Secretary is saying is sort of we're going on a month by month or maybe a 6 month by 6 month basis on figuring out this disagreement between the RISE parties and the state of Delaware parties. And so I think she's saying she doesn't feel she's authorized to go beyond June 30th of next year at this time. And a few months from now, if nothing's changed and it's still ongoing, and I think, I don't know which court it's in right now. If something happens and it gets clearer on what is going to be decided, what's going to be ordered by the courts, then she can do more. I think she's saying she doesn't feel she's authorized to. Now, why the state is continuing, whether the state would stop, I don't know. That's not my pay grade. That's the executive branch. But I think that's the reason behind her statement. I haven't spoken to her about it. I am guessing. That's the right word, isn't it? Pat, thank you. Mike, you are most welcome. What state committee looks into the reasons behind the rising cost of healthcare? Great, Mike. That's a terrific question. So the primary body that looks into rising healthcare costs is the state, as it relates to state employees, is the State Employee Benefit Committee. That's all they do, and they study the heck out of that. There's other groups that do that. There's legislative task forces that look at whether they should benchmark health costs and try to reduce the rate of rise. It had been going up at 6%. It was like, let's find some way to force it down at 3% or whatever it happens to be. We've had a whole bunch of study commissions, and there's a healthcare commission that looks into this kind of stuff. There's a whole lot, but the one that has to do with what we can do for state employees, including state retirees, is the SEBC. They are absolutely directly tasked with looking at the rising cost of healthcare. Legislatively, we look at things. We have legislators who will say, oh, it's all because of tort reform. We need to reduce damages and therefore malpractice costs and things like that. Other ones say, oh, we just need to improve our communication, and we've got a Delaware Health Information Network so that you go to one doctor, you go to the next doctor, the second doctor gets to see what the first doctor saw, so he doesn't do the tests again because he just had them done 3 months earlier by the first doctor. There are savings that can be done that way. You know that federally, the Congress passed a law that caps the cost of things like insulin. I think President Biden and Congress recently passed that. So there are efforts at both the federal and the state level to rein in rising health costs. But I'll say there's other sides that don't like that. They like to see rising health costs, like healthcare providers, pharmaceutical providers, lots of you've got a lot of powerful groups, special interest groups that are at odds with trying to fight rising health costs. Okay, I've already gone down that road of risking making myself very unpopular. There are those who argue that Medicare Advantage is one way to reduce rising health costs because it gives someone else, in this case, in particular case for Delaware, it would have given Highmark the ability to say, oh, retiree, you want to get this, your doctor says get this test done. That test has been a waste of time 90% of the time. There's a much less expensive test that's much more effective and costs less, and you need to do that. Or they may even say, this doctor keeps ordering those tests, and those are crappy tests. Any other doctor in your county would not order it because they know it's a crappy test. Your doctor does. We're going to say no. That's intended to cut costs. It does cut costs. Does it cut quality? You have given me wealths of articles on how it cuts quality and cuts, I'll say, it increases anguish and anxiety. But there's a lot of efforts to cut healthcare costs. It is one where there's no silver bullet, there's no single solution that's actionable. It's a gigantic question, and there's no simple answer to it. Okay, let me see, rising costs, Bud. With the current law reading Medicare Advantage as published on the web, can the governor just say we're going to do Medicare Advantage? So, great question. First thing is 3 co-equal branches of government: legislature, House, executive, governor, judicial, his judges, his courts. Number 3 said, number 2, no, you can't. You can't just go ahead with Medicare Advantage. That's what the judge said. Judge Scott, Calvin Scott, I think, right? So in October, he said, executive, no, you can't go Medicare Advantage. So no, nice, simple answer. The governor cannot just say we're going to Medicare Advantage. Furthermore, with the legislature, what we've built into laws, signed by the governor or overridden if there's a veto involved, said, we've got this Administrative Procedures Act. We've said, there's a process to go to do contracts. You've got to go through the public. And the whole lawsuit was we hadn't followed our own rules, hadn't followed our own laws. And so, no, the governor can't just say, here, do this contract. It's $100 million. I've signed it. It's good enough. No, you can't do that. There's a process you have to follow. And if you don't, you can be sued and stopped. It could just be raised to your awareness. Hey, you broke the law there. You got to back off on it, in which case you hope they admit that and stop. You can always go to the courts if it's clear, and that's what Rise did. No, the governor cannot just say it. So the current law reads that. Okay, let's remember what's happened. We have the SABC, which is the one that makes the decisions, and they've said no Medicare Advantage through June 30th of next year. That's done. Let's just take it. Okay, it's a win. Take a win. Okay, it's a win. Let's not worry about that. Let's worry about July 1st of next year on. Okay, that's what you need to be focusing on. Who's not voted on was the sense of the room. I think they were all concerned with the lieutenant governor being the voice of the governor and the voice of RHBAS. Not voted on was the sense of the room. Okay, I agree. I understand what I think, Pat, what you're saying is at Wednesday's meeting, it was the sense of the room that we didn't want to have Medicare Advantage, or wanted to have a statement that it was the sense of the subcommittee that we didn't want to have Medicare Advantage only thing. I do not question that description, Pat. I want to say the lieutenant governor is not the voice of the governor. Independently elected, don't answer to each other. They do work together. We've had, for instance, in the past, we've had one governor from one party and the lieutenant governor at the same time from a different party. So this is not, the lieutenant governor does not serve at the pleasure of the governor the way that cabinet secretaries do. So I want to point that out. Lieutenant governor is independent of the governor. I will be speaking on this issue probably this evening to figure out but my understanding is that I would have been uncomfortable if there wasn't a vote to include language like that in there. Understand the state signed the contract 2 days after the lawsuit. Okay. Rise will never give up. I have no reason to question that statement. As for the legislature rides in on a white horse, gosh, I'd love for that to be the view. Legislature, I think, will ultimately have a real role in how we move forward. If we, for instance, have a dedicated amount of the budget for many, many years that goes in, that's going to be partnership. I think the legislature is going to take a step. I think it's going to be supported by the governor for that part. To the extent that we make changes on eligibility for early retirees, spouses, things like that, that'll require legislative action. If we go that route and make no changes to Medicare, um, uh, keep in mind, for us to do that, we're going to need to partner with the executive branch, with the governor. If we do that and don't touch Medicare, one can argue, you may feel that, yes, even the governor and this legislature are on a white horse. So let's see which way we go. Okay, so next meeting. So I want to repeat that on the 15th, Monday the 15th at 2 o'clock, the State Employee Benefit Committee will be presenting the results of the employee survey that was done earlier this year. The next meeting, the RHBAS, is Friday, May 19th at 1 p.m. And the one after that will be on Monday, June 5th at 1 p.m. They're all available both in person and virtually. I will likely be not holding these for a bit because I don't think there's much going on, and because I really wouldn't mind having a Sunday afternoon without having to prep for this for quite a while and do stuff. But I don't think there's going to be new stuff to present. Okay, it's not a common problem. Most doctors don't order unnecessary tests. Sure, most, but I think if you have enough, it can be measurable. But I think you're absolutely right. I agree that most doctors are not doing unnecessary tests. Do keep in mind that we live, I love the phrase, we live in a litigious society, and that means that people like suing each other. That's a terrible term. There's more lawsuits per person in this country, I believe, than in any other advanced country in the world. So because of that, if I understand, some doctors order tests in order to protect themselves, to say, oh, I looked into that possibility, rare though it may be, because if it happened and I didn't do that test, you could come back and sue me and say I was negligent in not doing that. So I think there are some protective tests and there's some diagnostic tests. And those protective tests sometimes may be viewed as contributing to the rising cost. I have no idea if that's 0.1%, 1%, or 10% of the cost. I have no idea. So I'm already drowning in all the material I'm seeing already from RHBAS, not to go into there also. Okay, that was Jessica Lynn's. Judy, the Lieutenant Governor has been paying attention to your committee's finding. The Lieutenant been paying attention to your committee's findings and options? How's she been involved thus far? Judy's a great question. I think that I have to say, while I say we don't meet in smoke-filled rooms as far as the subcommittee goes, I have had many, many calls with the Lieutenant Governor, with Senator Townsend, 100% engaged, both of them. So I'll say, obviously, I'm a numbers guy. I'd like to dig into the numbers a bit, and I've taken more time to offer these things. That's my style. But as far as really being engaged in this, the Lieutenant Governor and Senator Townsend have been highly engaged with the work of RHBAS, despite all the other things that they're doing. I have a little less of a full plate than the two of them do, so I have a little more time, which is how I'm able to do this. But for that matter, I'll bring what I hear from my correspondence and from these meetings to them to share. I don't think we've got a real opposition from the public if we were to include that. That draft report, sometimes the handouts, I'll say, I'd like you to back off on that language so that by the time it comes out, it's less objectionable. And I think I can bring that awareness of some of the sensitivities of the retiree community to Lieutenant Governor Senator Townsend and the staff who support the work of the subcommittee. So I hope that helps. Not to forget that discussion of healthcare will coincide with the election of a new governor. Well, isn't that the case? Yes, Pat, indeed. I don't think it's skipped any elected officials. awareness that there's an election next year, and that many of the elected officials on the advisory subcommittee will be up for election next year, sometimes for the same position, sometimes for a different. And frankly, uh, if we as a government, state government, screw this up, I think the voters will recognize that. So I think there's a deep desire. I'm sorry, and there's also members on the subcommittee who are not elected officials, and also there are those who work for and report to someone, to an elected official who's not running for re-election next year. So yeah, there's different allegiances and different dynamics going on there. But there's a reason we've got 4 legislators on the advisory subcommittee, and part of that is because every 2 or in some cases 4 years, depending on the senators, at the statewide, up for election, we're out there talking to people regularly, and that's more so than oftentimes say a cabinet secretary or something like that. So yes, here's my cat. I think I can get a little more. Just get a stadium picture. You guys talk to the camera here, buddy. No, huh? So anyway, I think we've designed that so we've got people who are listening regularly to the public and sharing their views. I'm just not going to come to the camera, are you? There you go, buddy. You aren't going to look there. There you go. Okay, you can get out of here now, buddy. Okay, I think that's the rest of the questions. Lynn, you're most welcome. With that, thank you all. I will post up on Facebook when I offer this next. It could be 2 weeks from now. And not really sure. We will see. Okay. Thank you very much. Thank you for your devotion to this topic, often because you're deeply invested in how it comes out, but you've been very helpful, raising your concerns, sharing your concerns, doing so always respectfully, very constructively. Really appreciate it. Helps me do my job a little better. Take care. Have a great end of your day.